Well, there are concerns about the impact of advertising, and CCTV's Rachelle Akuffo spoke with Silvia Alayon. She's a nutrition and monitoring advisor of Alive and Thrive. And she asked just how much influence these commercials have on how mothers choose to feed their babies.
There is a lot of evidence that mass media campaigns can have an impact on a variety of child health behaviors, including breastfeeding. We know, for example, from our experience on the Alive and Thrive program in Vietnam, that a mass media campaign, especially when coupled with face-to-face communication with moms and policy environment that's supportive of breastfeeding, can have a profound impact on exclusive breastfeeding. In Vietnam, for example, in the areas where we worked, this comprehensive approach resulted in a threefold increase in exclusive breastfeeding in just 4 years.
And what are some of the reasons you think that the breastfeeding rates are so low in some areas?
I think that's very contextual, and it very much depends on the country. And even within a country, there could be many reasons why mothers do not breastfeed. What I do know is pretty common across all countries is that mothers really need a lot of support to be able to exclusively breastfeed. And that begins at the time of delivery with the providers that are present at delivery helping the mother to attach in the first hour after birth, as well as their peers and grandmothers and fathers and community leaders. Having this network of support can be so influential in a mother's decision to breastfeed.
Now, what do you think global formula brands can do to compete? If governments are saying, you know, we want more mothers to breastfeed, what should these baby formula companies do?
You know, a lot of governments are trying to increase the rates of exclusive breastfeeding. And what we do know is that it takes a comprehensive approach to achieve that. And by that I mean policies that are supportive of breastfeeding, such as appropriate maternity leaves that allow moms to be home with their babies to exclusively breastfeed for the 6-month period. And by exclusive breastfeeding, I mean only breast milk, no water, no juices, no food until that baby is a full 6 months. We also know that face-to-face communication with mothers and mass media campaigns can help increase those rates of exclusive breastfeeding. Mobilizing communities so that community leaders and everyone is involved in supporting moms is key.
Do you think that formula companies can compete? Is there anything that they can do? They've tried to obviously develop it over the years, adding things like DHA for brain and eye health and things like that. Can they compete?
Well, I think there's a few things infant formula companies can do. To begin with, I think the quality of breast milk is always the best, and you cannot compete with breast milk. Another thing that infant formula companies can do is adhere to the code of marketing of breast milk substitutes and ensure that their marketing is not interfering with breastfeeding.
Now, breast is best. It's something I myself heard as soon as I gave birth to my daughter. They were like, try as hard as you can. And that can be a lot of pressure on new mums. And some new mums are even resorting to purchasing breast milk online if they're not succeeding. What are some of your thoughts about purchasing breast milk online when you don't really know that much about the source and any sort of health problems that might be getting passed on?
Well, I haven't worked in any countries where the online market for breast milk is, very large. What I do know is that it is very important for health providers, and that's pediatricians, nurses, in certain countries, community health workers, to be very capable in supporting moms.
And as we look at some of the areas where breastfeeding is most popular, whether it's through a lack of funds or a lack of access to formula, many of the countries that have these high rates are underdeveloped ones. How do you get developed countries on board when they're used to the convenience of having baby formula?
First, I don't think that we can make that generalization that all of the underdeveloped countries are the only ones where breastfeeding rates are high.
But the majority?
Well, there are some cases where low-income countries, for example, Chad, have very low rates of exclusive breastfeeding, and you can contrast that to countries in Latin America like Peru and Ecuador and Colombia that have much higher rates relative to lower-income countries. What we do know about breastfeeding is that all children benefit from exclusive breastfeeding for 6 months, and the benefits apply to children, whether they're in a high-income country, a low-income country, whether they're born to a rich family or a poor family. The benefits of breastfeeding sets them on a trajectory for healthy growth, for improved development, and long-term educational attainment, and even job productivity later in life.